Good afternoon. This is County Executive Pat Ryan. Thanks for tuning in. Today we're going to have a pretty, I think, straightforward and short update on our COVID progress, our vaccination progress. Thank you for taking a few minutes. We will dive right into the numbers, which continue to improve and look really good. So thank you to everyone continuing to do your part to really get the COVID infection rates down and the spread slowed and ultimately stopped here. And we think we're really starting to now see the medium and long-term impacts as well of our vaccination numbers going up and up, and that helping to bring the infection rates down. So total cumulative cases in the county since the beginning of the pandemic are now at 14,710. Total tests at 357,445. With 13,913 recovered, and unfortunately one additional fatality in the last 48 hours since our last update, bringing the total to 255 Ulster County residents lost to COVID. Hospitalizations are the one metric that is still concerning and has stayed relatively steady at far too high a number. Currently have 17 Ulster County residents hospitalized, 3 in ICU beds, and as you can see on the graph, that's actually slightly up over the last few weeks. But our hope is that as we start to get the other numbers down, hospitalizations will eventually follow. The very good news is that our active case numbers continue to rapidly drop. We are now at 542 active COVID cases in the county, and you can see, thankfully, a very steep decline there, particularly over the last few weeks. That is both a credit to each of you and us all doing our part to continue to follow precautions, as well as the impacts of the vaccine, which we know works extremely well. And as we get our percentages of residents vaccinated up, we will hopefully continue to see those active case numbers come down. New positive test rates are also down, which is very encouraging. In the last 48 hours, we tested 2,485 county residents and had only 76 new positive cases. That puts us at a 3.06% new positive rate. It's right around where we were in our last update on Tuesday, far below the much higher numbers we were at for quite a while, approaching 9, 10, 11 plus percent. We need to continue to get this 3% down, though, to 1% and ultimately, of course, to 0. But being right around that 1% or less gets us very, very close to effectively having de facto contained the spread. But we're not there yet, and that means we have more work to do. Hospital capacity, we're in good shape there. Once again, 17 currently hospitalized, 3 in the ICU on ventilators, and more than sufficient need in the long term. Or excuse me, more than sufficient capacity for the long-term need. Until we get to herd immunity, unfortunately, we all continue to have to wear masks to maintain distance, to wash hands, to avoid social gatherings, particularly among those that have not been vaccinated. As I talked about on Tuesday, we had just gotten the news from the CDC beginning to ease some of the mask restrictions. New York State, as we expected, immediately followed and extended the same guidelines. We have a detailed infographic up on our webpage and social media, but at the high level, what it basically means is that those that have been vaccinated, which is now over 52% of the residents of our county, thankfully, are able to remove masks outdoors and doing a certain set of activities outdoors and even in small gatherings. So that is very good news. It's a small step. We want to take much, much bigger steps. I know we all want to get back to not having to wear the masks. But at least it shows that the science and the CDC feel comfortable that the vaccines are working and that as more and more people reach vaccination point, it is safe to begin to ease up. So I know for me personally and many of us, that is very encouraging, and we will continue to just see us head more and more in that direction, but it requires everybody doing their part to be vaccinated. So shifting gears to our vaccine progress, or vaccination progress, we still have not received the countywide allocation numbers, unfortunately. They're slower than usual this week coming from New York State. So once again, all I can report today is what the county health department directly has received, which is 2,170 vaccines. I'll talk in a minute about the various vaccination sites and clinics that we have going, but we do still have sufficient, if not more than sufficient, supply. So supply is not our challenge. It's really making sure that we get everybody motivated to be vaccinated and that we make it as easy as possible to remove any of the logistical hurdles or other technical challenges or transportation challenges. And I'll talk in a minute about all the different things we're doing here in Ulster County to do that. And I think we'll continue to do more as we hopefully get the remaining balance of our residents vaccinated and get to that herd immunity point that we're all striving towards. This week, for the first time, we hosted a series of town hall-based walk-in clinics in several towns across the county. They were really successful, and I want to especially just thank all of our town leaders, county legislators that helped organize those, other community leaders, our volunteers at those sites. I visited 3 of the 4 sites that we held this week, earlier in New Paltz, Rosendale, and yesterday in Rochester. And today happening still, although I think they might have just ended in my hometown of Gardner. I especially want to thank the supervisors in each of those towns, Supervisor Neil Batez in New Paltz, Supervisor Walsh in Rosendale, Supervisor Mike Baden in Rochester, and Supervisor Mary Beth Majestic in Gardner. Working with your teams and letting us use your space. It really changed the dynamics, I think, for many folks. We got several hundred folks cumulatively through those clinics. We don't have all the final numbers, but we know several hundred went through those. And in talking to people yesterday and the previous days, there were a lot of folks who said, you know, I was a little intimidated to book online, so being able to walk in really helped. Others said it was just a little bit too far or too much of a challenge to get to the mass vaccination site at the Hudson Valley Mall, but it was much easier to come to my town hall or to a community center where I know and where it's a little less of a mass scale operation, and it just feels a little bit more comfortable and a little less intimidating. So we are absolutely going to continue these walk-in clinics. We think they were a big success, and they're going to be a key part of getting the remaining balance of our county residents vaccinated. So next week, I'm going to put up a schedule with really 5 more, and the one happening today, walk-in clinics, to give a preview of what's to come next week. Once again, to reiterate, these are there are appointments available, but also they are walk-in, so no appointment required. Today, as I said, we finished our final town site for this week in Gardner. And then tomorrow we'll be doing a walk-in clinic as well as appointment clinic at the Hudson Valley Mall site. So there will be a separate walk-in lane at that location. So folks that have appointments, you'll still be able to show up by your appointment time. But if you don't have an appointment, you can just show up to the mall between 9 and 6 p.m. And be vaccinated. Monday will be the same thing, May 3rd at the Hudson Valley Mall. Tuesday, we'll be partnering with the Esopus leadership at their town hall from 1 p.m. to 6 p.m. Wednesday, I want to thank Peter Criswell and the team at the LGBTQ Center for hosting us there. That will be Wednesday afternoon from 1 to 6 p.m. That's the LGBTQ Community Center. And then also, just as a heads up, on Monday, May 10th, the following week, we'll be doing another town hall at Shongum Town Hall. I want to thank Legislator Ronk, Supervisor Valk, and the team there. So what I'm really proud of and why I think it's so important to thank all of our local leaders on the ground and volunteers, we're really seeing all of the community step up and find new ways to make it easier to get this life-saving vaccine to our residents that are wanting to get it. We're going to continue to do that and also continue to try to innovate with new ideas and approaches to make it easier. Once again, it is still no-cost rides available on our UCAT bus system, so transit should not be an option, and also being able to go to your local town hall helps greatly there. So how are we doing on progress in Ulster County? By the numbers, we continue to make really good headway each day, seeing our vaccination progress numbers tick up. Of course, we want to make that as rapid as possible. As of this afternoon, Ulster County was still leading the Mid-Hudson region with 52.5% of our population getting their first dose. You can see the exact numbers. 93,778 have gotten their first dose at least, and 69,000 plus have received both first and second doses. Just as a comparison point, once again, Ulster County at 52.5, New York State average is 45.6. So that is a real credit to all those folks I mentioned, all of our volunteers, all of our partners, hospitals, medical practices, pharmacies. Everybody's been doing their part and really rallying to get the vaccine to folks. And now what we really need from you all watching, from all of our residents, we need every single resident of the county to do their part. Really, I think to do, frankly, their duty, to make sure that they get this vaccine, not just to protect themselves and their family, but to protect everyone around them, their coworkers, and folks that they're interacting with. That is our only path out of the challenges of the last year plus, is the vaccination path. And really all the other precautions like masks are just buying us time. So the faster we can get everyone vaccinated, the faster we can move on, get businesses open, get schools fully open, and really accelerate our economy and our community coming out of this really challenging last year. All the information that you might need to be vaccinated or to share with others is at vaccinateulster.com. That has sign-up links. It has all the details about our clinics. It has information about transportation. It also has frequently asked questions about the health implications and any medical-related questions that folks might have about the vaccine, to make sure that we're all fully informed and able to inform our neighbors and friends. So please check out vaccinateulster.com. If you're feeling like you want to do even more, we still very much need volunteers to help us at all of these clinics. Frankly, running these town hall and walk-in clinics is actually a little more resource intensive because we're spread out. So we actually need even more volunteers. So if you've been thinking about doing it, please go to ulstercountyny.gov/volunteer. We are paying a stipend for both medical and non-medical volunteers, and we need both. Just talked to a person in Rosendale who said, I'm going to sign up, and was excited to volunteer. So we still very much need your help and appreciate your help, and thank all of our current team of vaccine volunteers. I also want to thank all of our frontline workers continuing to do their part through the pandemic, continuing to keep us safe and continuing to keep all these essential things happening, from health to food to transportation, education, public safety, journalism, and first responders, so many others. Thank you, all of you, for what you're doing. Thank you to all of you again for tuning in for our update. We are approaching 100 of these. We're not there quite yet, but I can't believe that we've done almost 100 of these so far, and we'll continue to do them and keep everyone updated until we can fully get through this crisis and come out the other side. If you need anything in the meantime, you can always call our Recovery Service Center or share this information with those that might need it. That number is 845-443-8888. You can see the website there as well. Thanks to Radio Kingston and Diane and Manuel for translating and interpreting. And We will see you next week for our next update on Tuesday. In the meantime, stay safe and healthy and continue to be resilient through this, and have a great weekend.